So right now, there's a measles outbreak going down in the United States. We have a vacant Surgeon General office position and a wellness influencer who thinks Tylenol is dangerous. The solution that the government has landed on is to put all these things in one room together and see what happens. And today, with Casey Means, Surgeon General Senate hearing, we're finding out.
You called birth control pills, and I'm going to quote, a disrespect of life. And you said Americans, quote, use birth control pills like candy.
So the Surgeon General decides what schools tell parents, what doctors cite during outbreaks, and what the federal government says when people are terrified. And today's nominee had a chance to give some straight answers, and of course she didn't. But the answers aren't even the most alarming part. And I'm going to get to that at the end, because the thing that nobody's putting together isn't in the headlines right now. And real quick, I'm Lauren Paritra. You may see or hear from my furry four-legged co-host behind me, but what we're going to do is ask you to take a quick moment to subscribe. Make sure you're subscribed, because Willa and I are currently in the lead against Katie Miller. Katie Miller is the wife of Stephen Little Bitch Miller. She married that pale white nationalist on purpose, and he's the man behind all of this ICE terror. And she is building a podcast on the backs of trafficked children. So consider every sub, every hype, every like, every share, every comment, 7 words or more, as an FU to Katie and Stephen Little Bitch Miller. We can't let them win. So Casey Means went to Stanford Medical School, which is impressive. We'll give her that. And then walked away from her surgical residency because she lost faith in traditional medicine. She got a little green pilled, if you will. She built a wellness platform, wrote a book with her brother, got 845,000 Instagram followers, founded a company that sells glucose monitors, and that worldview is now one that the Senate is one vote away from running federal health messaging. Senators asked her straight up whether she would tell parents to vaccinate their kids against measles.
We're on the verge of losing our measles elimination status. Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine?
I'm supportive of vaccination. I do believe that each patient, mother, or parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body.
There is an active outbreak, a very active outbreak in South Carolina right now, the worst in 30 years. She said parents should talk to their pediatricians. And when pressed, she said she isn't anyone's personal doctor. She is not anyone's personal doctor, and thank God for that, but she is in her Senate confirmation hearing to become the Surgeon General, which is that person's responsibility. Both of these things are completely avoiding the question, which is the exact problem. The Surgeon General's job is to give clear guidance when uncertainty is dangerous and imminent. And what she offered was what a regular person would say when they don't want to take a position. Outside of the hearing, she's also been considerably less careful and a whole lot messier. She said that taking Advil a few times a month is ultimately toxic.
When we think about all the things we're choosing to experience in moderation in our world, it's a little bit of water from a plastic bottle and a little bit of this Advil that I take 2 to 3 times a month. We're applying this principle of moderation, but then we're inundating ourselves with so many inputs that are ultimately toxic.
She has publicly questioned why women are allowed to use birth control.
We've got a huge percentage of American women on birth control pills. That's, of course, hopefully post-puberty. It's very ubiquitous now in the environment. And it's like, when you kind of know this stuff, you're like, how are we allowing this to happen?
And when a senator who brought up birth control comments during the hearing, she said it should be accessible to all women, which contradicts what she wrote publicly and is very typical of MAGA. These comments weren't dug up from somewhere embarrassing. She's putting these clips out there and voluntarily doing so as part of her public messaging. And that message is the reason she's sitting in front of the Senate right now. Her brother, Callie, co-wrote her book and is currently advising RFK Jr. inside the Health and Human Services Department. This isn't one person going rogue. It's a whole family shared project, and now they could potentially be part of the cabinet and have that whole platform behind them. So senators asked whether vaccines caused autism, which is crazy that we are here. And the study that suggested they did was retracted, in case you missed that. The doctor who wrote it lost his medical license. And when she was asked this very simple question on where you stand on all this, she said science is never settled. She wasn't being thoughtful or cautious. She said that out loud. And she was giving a discredited idea just enough oxygen to keep circulating in these spaces where people are outraged over Red 40, but not over starving kids. This is somebody who could potentially be making decisions around the guidance that we give to families and children. The fair pushback is that questioning pharmaceutical companies is reasonable and American healthcare has real problems worth examining. Sure. But there is a difference between critiquing drug pricing and refusing to endorse a measles vaccine during a measles outbreak. One is a legitimate policy conversation. The other is how kids end up hospitalized and dead. Most people won't watch the hearing. They'll notice later when vaccine requirements quietly change and when federal guidance gets a little bit more vague. And when officials start to sound like something you've read in a wellness newsletter. The Surgeon General's office shapes all of that. And when it's occupied by somebody who won't confirm that vaccines don't cause autism, the consequences don't announce themselves. And here's the part I promise. It's not the Advil comments and it's not the vaccine dodge that is so terrifying. Means received tens of thousands of dollars from companies whose products she promoted on their platforms. She's now being nominated to the office that tells Americans which health products are safe. That conflict of interest has barely come up in this coverage of this hearing at all. A senator also asked her about taking magic mushrooms, which might have been the most relatable part of it all. And she said Americans are ready to hear about spirituality and medicine, and that somehow that got more attention than the fact that this person, who will likely oversee federal health guidance, has direct financial ties to the wellness industry that she would be regulating. That's the part worth being really pissed off about. And I need you to now share this with your contacts, post about it. We got to get angry. We got to organize. We got to call our senators. And I need you to make sure you take a moment to subscribe. Consider this an FU to Katie and Stephen Little Bitch Miller. We cannot grow without your support and we cannot get this messaging out there. So please, we got to help drown out those crazy voices, and we'll be back with more.